Paranoid personality disorder, or PPD, is a mental health condition that often leaves individuals feeling constantly on guard, overly suspicious of others, and as a result, reluctant to form close relationships. Have you ever met someone who seemed to distrust everyone around them, even without any apparent reason? They might be experiencing symptoms of paranoid personality disorder. PPD belongs to a group known as Cluster A personality disorders, which are characterized by odd or eccentric ways of thinking. Typically, beginning in early adulthood, the disorder can have a profound impact on a person's life. But what exactly causes someone to develop PPD? The precise cause remains unknown, although a combination of genetic and environmental factors is suspected. Some research suggests that early childhood experiences, including trauma or abuse, could play a significant role. Individuals living with PPD often exhibit a range of behaviors that stand out. They tend to be suspicious of others, interpreting innocuous comments as threatening and viewing benign actions as personal attacks. This makes it challenging to maintain personal and professional relationships. For instance, a neutral conversation might be viewed as a veiled threat, leading to unnecessary conflict and isolation. They often hold grudges and find it hard to forgive, attributing malintent to others' actions, which aren't necessarily there. Moreover, PPD sufferers may avoid confiding in others, fearing that personal information will be used against them. This creates a barrier to forming deep, trusting connections, leaving them isolated and misunderstood. In work or social settings, they might be overly concerned about hidden motives, leading to a lack of cooperation and collaboration. It's important to note that paranoid personality disorder is different from paranoia associated with psychotic disorders. People with PPD do not typically experience delusions or hallucinations. Their suspicions are more subtle and pervasive, often leading them to question the loyalty and trustworthiness of those around them, without any concrete evidence. Managing life with PPD can be incredibly challenging, not just for the individuals, but also for those around them. Treatment primarily involves psychotherapy, focusing on building trust through cognitive behavioral techniques. Therapy aims to reshape the patterns of thought that lead to suspiciousness and facilitate healthier ways of interacting with others. Pharmacological interventions are not a primary treatment for PPD, but medications might be prescribed if there are co-occurring conditions like depression or anxiety, which can complicate the disorder. Creating a supportive environment is crucial, encouraging those with PPD to express their feelings and fears without judgment. While PPD can be a difficult disorder to live with, understanding it better can help foster empathy and support for those affected. Recognizing the signs and encouraging professional help can make a world of difference, helping those with PPD navigate a path towards a more stable, fulfilling life. In conclusion, understanding paranoid personality disorder is a step toward compassion. By recognizing the symptoms and potential influences, we can support individuals in seeking appropriate treatment. Encouraging empathy and patience, we can help break down the barriers of distrust and isolation.